Okay, if committee members could come back and, no, I hope not.
Chairman, we decided I'll come back when the room gets to be 73.
Right, exactly.
Yeah. Hit the button, doesn't go up.
All right, so let's just have a general conversation here about what were some of the impressions that you heard this morning, and then and it's my intent to be out of here by 12:30. All right? Okay. We need to warm up. I don't know about you guys, but anyway, any general comments, or any impressions that you had this morning that? Yeah, okay, yes, Muriel?
Yeah, I would say we don't have enough staffing for anything. So how do you fix that problem? Other than, student loan forgiveness or whatever for these jobs. And I don't even know if that would help any, but they're going out of state. So how do you, I find it interesting, Corinne, when you mentioned the 101 aides. We keep getting more 101 aides, but these kids, some of these kids, it's you're just trying to put a stopper on what they're doing, and are you really educating them? So that's just my thought. What do you do about it?
Representative Dry?
Thanks. Working on that, when we were talking about the school nurses and being able to do it before you finished with your degree, for example. So I would be interested in looking at those rules of where that has a basis in law, of who does tests for what, and see if we can do a similar situation.
Okay. Representative Tanner?
I kind of go back to the training as well, that, unless you have trained people that are specifically trained and as she said, professional educators dealing with these problems, I would hate, because we have a staffing issue, to water it down, as far as that's concerned. And I think we also need to look at what legislation we're passing that makes things easier and better for people, and what legislation have we passed or that we have been talking about that actually diminishes the ability of the schools to reach kids that are having mental health problems, or to deal with kids that just have social emotional problems on a daily level. At one point, somewhere in school psych or whatever, they often talked about how teenage years are a mental condition in itself, So, it's every day when you're teaching, you have these little things bubbling up in your classroom, or kids coming in, or if you're coaching, oftentimes you get kids coming and talking to you. And considering the climate right now and some of the legislation we've passed, I feel as a classroom teacher, I would be very hesitant to do or to talk about certain things, and it restricts your ability to interact with kids.
Representative Damon?
Echo everything that's been said, but also, the difference between mental health education for the entire student population, I believe, is a very, very different opportunity than much of our discussion today about how are we addressing the needs of students who have a mental health condition.
Yeah.
And I think it's important when we talk about 505 and the whole bundle that we are careful to separate how and what might we be educating so that people have a better understanding of mental health, which isn't treatment. It's not therapy. The educators do need appropriate knowledge and training for sure, but it's not anywhere near the level of training of a professional who would treat a mental health condition. Not all mental health conditions can be prevented, but many are less likely to occur if people know the risk factors and know the lifestyles and behaviors that reduce risk.
Yeah, that was an aha moment for me too. I mean, the whole issue of the curriculum of education vis-a-vis what's the intervention service.
Right.
And that's one of the places where you get into the whole staffing issue of what's available. I mean, when you hear somebody that's got to wait 2 years to get a damn referral to services, I mean, that's amazing. I'm sorry. Sorry, I spoke a little bit, but I got Woodcock.
Jump right
Oh,
on
okay,
your
all right, all right.
and I'm sorry, no, just jumping onto Hope and Mel's comment right there. You know, I'm sort of seeing it as really three things though. There's the what are factors that contribute to it, how do you go about treating it, and how you go about identifying it. So, you know, I think the point Linda made was really getting at what are the factors that contribute to this epidemic? And is this partially an epidemic of our making? And, you know.
Can I answer
Let me
that?
cut in for just a second on that. I was reading a report that came out in 2003 regarding civics education in our schools. Here's a statement. Many teachers fear criticism or even litigation if they address topics that may be considered controversial or political in nature. So what we're experiencing today is not uncommon from what was experienced 20 years ago. And so I think that we have to get away from that a little bit and be able to get into the ability that we're going to be discussing and talking about these topics, and mental health is one of them. And we've got to resolve it, and we have to have those intervention resources available. And it's handled differently. And I honestly believe a lot of it is based on resources in a community, but also leadership in the buildings. If you don't have proper leadership in a building, with all the money in the world, you're not going to get things fixed. And I can recall as a principal, I invited community mental health to come in and be in my building. I provided them a room 2 or 3 days a week, depending upon where we got with that need. We were a school of about 500 kids. And I had all the resources there, but I was lacking the resource of community involvement. And I was acting like that silo I sometimes talk about. And with that, within 3 or 4 years of bringing community mental health into the building, our issues in the building just lessened. It was just a wonderful environment. And it wasn't coming from a prejudiced principle here. It was just very observable by community and parents altogether. But that resource has to be available.
Well, that's what we were talking about today when you weren't here, Chair Ladd, that even if schools want to bring in the mental health professionals, there's such a shortage right now in every area that there can't be wraparound services because there just isn't anything available to
And the
do it.
grant money dries up
Yeah.
and the state doesn't assume that burden. And that's what's happened here, and it's happening right now when we're losing the Gopher money and everything else.
Yeah, and do you remember when they closed the state hospital 30 years ago and they funded the community mental health centers, how well they were funded and all the services they could provide? And they aren't funded at all now. It's really cut
Well,
down.
and one of the things we talked about too is whether Jane can find out some state models that we might want to look at vis-a-vis what we currently have here. That might be at least a platform for us to begin to look at what some of the components might be.
ECS might be able to help us.
Yeah, that's true. ECS might be able to help us, yeah. Yes, Representative Lakis?
Education Commission of the States, and Jennifer Ford is listening to this, it's being streamed, and she's going to review this whole thing, and she is a researcher that's available to us.
Good.
Yeah.
I'm wondering, schools still have to be schools, and they still have to teach. And teachers are trained to teach, but they're not trained to be psychologists. And what we know from social emotional learning is if it's going to be effective, it needs to be in the school, at the home, and in the community, and they all have to work together. And it seems like part of we have a couple of breakdowns. One is in the community, what do we do about that? I mean, here we are, we're education, right? And it seems like we're trying to solve in education a fundamental underlying issue with community. And even when you get, as they were saying, even when you get referrals to outside sources, the parents don't get them there. And so there's that whole breakdown. And how are we as educators dealing with, or can we even deal with, the overall cultural breakdown? There is, not just in our state, but all over, an extreme shortage of trained people, healthcare workers. And so even as they were saying, how can you get somebody like that in the school when you can't even get them out of the school? And part of that, as I'm discovering through my husband, who's on ED&A, is all the requirements on licensing and all of that kind of stuff. With psychologists in this state, they're finding that, and we've talked to some, that it was a totally subjected, somebody could have, we talked to a man who went through all of the school stuff, passed all of the things, passed all of his exams and everything. And then they had a, how do you feel about this? And they wouldn't give him the license because they had an agenda, they had a political whatever, and he didn't fit that. And that's, I mean, that's not an education thing, but it is happening in our state. And we talked to this guy who now is looking for a completely different type of job, just because whatever reason. So that's being done in ED&A, and they're trying to look at licensing and trying to clear that up. So that may help with some of our supply. But I know it's a crazy thing that something should be subjective instead of objective as to whether or not you get a license.
Well, one of the things too that Melissa talked about was the issue of the agencies working together. And I can vividly remember the conversation we had in this group when we were talking about Medicaid expansion. And you had the HHS over here and the department, or the education department over here, and said, okay, well, how are you talking to one another? And I would think that goes back to the whole question of how do you get these multiple agencies to provide the kinds of foundational support that's there, regardless of where you are, but at least you need to be talking with one another. Representative Woodcock?
Thank you, Mr. Chairman. I want to go back to a couple of points when you started the discussion. What do we think from the earlier meeting? I think Linda was hitting on Representative Tanner. Part of not necessarily the CRT crapola, but rather the linking of administrative rules and teachers losing time in the classroom, special ed teachers losing time in the classroom for the amount of regulatory things we put in across the state, or DOE puts in, that takes the time to get away from teaching. But the bigger piece of this to me is the fact that it's clear, to me anyhow, and is everyone I'm sure on this table, that we have a youth mental health crisis in New Hampshire, and we have it in the United States. But right now our focus is on New Hampshire. And the model that we're using, the delay, referral, tests, waiting lists, all that time, those youngsters aren't getting the adequate education they should be getting. I'm not talking about funding wise, I'm talking about in real life with teachers and staff. And I disagree with Alicia. And I think that we need, the school, unfortunately, is put in the position that they have to take on more of a task. As we have kids who need food, we have to feed them. Some of us think we have to feed them. As we need, if the kids need mental health, we have to provide that, because if we take any of these pieces away, the educational success of the youngsters is not going to matriculate. So I'm thinking that we really need to look at, it's not, if it ain't broke, don't break, don't fix it. I think it's broke. I think the way we look at mental health and education here under our auspices, under the legislative auspices, under the DOE auspices, is broke. And this is just one piece of that. And we can't wait 5 or 6 or 7 years to say how we're going to go back and fix this. These kids that are there now are going to 5 or 6 or 7 years, forget the testing results. They're going to be folks out of the school who don't have skills. And I think that's what we can't keep on delaying. And I think what came to me today, as I listened to all three, and we have 3 different presentations here coming from three different perspectives. And they all basically said the same thing. We got a crisis. And the traditional way of fixing things just can't be doing that. So that's what you asked when you started the dialogue, Roseanne Milo. What did you get out of the meeting? That's what I get. We have to step up and do something and not put it on the slow mode to like 5 years waiting again. Thank you.
Representative McDonald.
And thank you, Representative Myler. And yes, this is important. And the first presentation was from UNH Extension. And on the handout they gave, they have survey data from the Youth Risk Behavior Survey. These data points that say concerning information about students attempting suicide and mental health risks. We've had previous discussions about this survey and have determined that at best it might be inaccurate, and the department has testified today that at the very best
That's your own conclusion.
is backdated 2 years. So my question is, because this is so important, what can we do to get more accurate survey? Because since resources are so limited, we need to unfortunately target these resources to those who need it most. And how can we tell that if the survey data is a little bit at least backdated 2 years? So my question is, what can we do to improve this survey data?
Okay. Representative Luno.
Thank you very much, Mr. Chair. You had mentioned about the silos, and I'm wondering if we're sort of jumping into one here as well, because I think the area that we're talking about certainly extends far beyond the typical policy areas of this committee. And when you were talking about it earlier, Mel, it made me think about some of the policy areas that the HHS committee gets involved with, and some of the policy areas the Commerce Committee gets involved with, particularly when it comes to mental health parity policy, with respect to different insurance programs. And we're certainly, I think, our 2 hour, 2 hours worth of meeting this morning, certainly the words funding came up a number of times, and possibly funding mechanisms for this sort of for mental health could come from outside of the typical adequate education funds. And when we take a look at the numbers, and we can disagree on the numbers, but I think it's certainly affecting a substantial number of students, and the result of that effect is not inconsequential on the students' learning and their success in life and our economy and everything else that contributes to that. But possibly, Mr. Chair, we may want to convene maybe a work group that includes some folks from HHS, some folks from Commerce, and I was particularly looking up maybe talking like John DeJoy, who would spend quite a bit of time in Commerce, and has, I think he also represents the mental health counseling, I think, Jane. That's certainly something that we're talking about as maybe being a resource.
Yeah, you're suggesting that we have our silo here.
Yeah, that's what I'm suggesting. is that we're siloed.
So here's what I have. This is not a definitive list, but I've got what we've talked about in the last 20 minutes. We've got the issue of staffing issues, training of educators around this issue, the impact of legislation, both negatively and positively, around schools and services, etc. We talked a little bit about the differentiation of health education versus services and intervention issues, which are separate. And we talked a little bit about state models, and then the issue we just talked about, perhaps the need to have some joint committee work on this. And I think also the issue that Representative McDonald mentioned too, are there other metrics that we can look at too that would go beyond just the one survey? I mean, we need to see what are the issues out there where we've got some metrics around this, and not just the one survey that we've talked about here within this committee. So those, I think, Mr. Chair, those are the issues that I think that we've been talking about in your absence.
Those are good. And I'd like to just echo what I heard yesterday from several teachers which were testifying, or was yesterday or the day before. Teachers are being spit on right now. Things have changed since COVID. Kids, for example, even the two high school boys I put on the plane last night to try to get to Myrtle Beach, got down to DC and had to do a little bit of time there because of the storms and all. One had the experience of being in school during COVID 1 day a week. The other student, because he was in a lower grade, and was there for 4 days a week. Guess who has the good study habits right now? Guess the one that's on task? And the one that is still very compliant and knows what rules mean. The one that was there 4 days per week. It was the one that wasn't was pretty much on his own, doing his own thing. And now we have kids walking in the door of the schoolhouse with some of them with that type of mentality right now. And it's been very, very difficult. In fact, I have a daughter who is a special ed teacher dealing with life skills, and she was pushed down the stairwell and had to have her hip replaced by a kid that was just emotionally disturbed. And so but that's not necessarily uncommon today. We have teachers being hurt, and we have other kids being hurt. We have desks being thrown around, and it's pretty sad when you have to evacuate a classroom saying all the kids are doing a good job, get out of here, and we'll take care of the one that's not. That's kind of, a reverse psychology than what I've been used to as an administrator or teacher. So there's a lot we have to do here, but the data we're using, I'd like to make sure we're using solid data. I'd like to make sure that there are schools where maybe they're not having the degree of issue. My question would be, what's so different about that school then? What's the best practice that they're doing there? And so we oftentimes look at figures and we say, well, this percentage is apropos for the whole state. Well, maybe, maybe not. I know that when I talked to Senator D'Alessandro, he was saying, well, we have, folks in every one of our schools now that is a community resource type person because of the dynamics of the student that's coming to them. And so what's good happening in Manchester may not be happening in Hopkinton. Maybe, I don't know. So I'd like to make sure the data is accurate, and that's the unfortunate thing. I don't think we've ever really gotten good data. I know that, I've asked for data before from DOE, on costs of things, and they've been like $3-4 million off. And that was not uncommon 6 or 7 years ago. And so it's whether they don't have the personnel or they don't, the accountability is something which we're lacking. The knowledge of what's going on in the schools. And somehow the survey work, we can't be satisfied with a 20% return or a 30% return. You get those from those that are compliant returning. But I'd like to see something. We talked about the health survey they get back every biennium. When you get a hold of that, and I'll make sure everybody gets a copy, you'd be very appalled to see what's on it. There are some that just say, no, I'm not teaching PE. Green.
I'm wondering if the regional public health centers might be able to be a part of coordination, because when you're talking about agencies, sometimes it can be done in regions so that they're coordinated. That's one thought. School districts who have a healthier financial budget also hire full-time social workers in their districts. Poor districts can't get that. That's a key parent-school connector. The third piece to think about is a lot of schools have done the response to intervention model or the multi-tiered systems of behavior. The PBIS is also another model, or responsive classroom at the elementary school is a model. But data collection is key for all of that. And if you have a social emotional learning program, you have to collect social emotional data. And so I question, I mean, we issued a screening to young kids to make sure they were okay. You know, it's a check-in type process. But the legislation on non-academic surveys now may curtail that. I mean, is that in conflict? I don't know. Maybe.
And adding to that, do we know what Keene's doing, what Plymouth State's doing, what UNH is doing in terms of preparing these folks that are coming up to the elementary schools, coming out of a program? What type of skills are they being taught? Do we need that data? I would say we do. We need to do some looking into that. I don't know if Mill's still running this or not, but Alicia.
On that note, my question, yes, we have rules about student filled out data, but there's a lot of data we should be able to have about how many behavior issues a school has, what they're seeing in particular. I mean, that's teacher and administrator filled out as opposed to, because there are no rules about what they can. Now, teachers say, I'm supposed to be teaching, I've heard this a number of times, and not filling out surveys and not keeping track of numbers of incidences and stuff like that. But it seems like, can we somehow look at the evidences of disturbance as opposed to trying to just do a student survey?
The Teacher Shortage Committee has requested that we have some principals come in. It was brought up just the other day when we were talking about this very issue that a teacher would notice that there's a problem in the classroom and it's a disruptive problem, so the kid is sent out. 4 minutes later, the kid's back in the classroom after being down in the principal's office, and it hasn't been resolved. But you have to deal with it. So that's not uncommon. So how do we capture that information? And that's why I said at the very beginning of this thing, leadership in the building is imperative. And you have to have rules within a building, and we can't get away from that. And unfortunately, a lot of them coming out of COVID, they don't know what rules are. And the parameters are now wider than they were pre-COVID. And that's part of what I believe we're encountering. Not all of it, but part of it.
And I was wondering whether or not the disciplinary record might be some data of use to us. Because if people are acting out, there's some causality in there. We don't know what it is, but it's there.
And the department collects that information.
Yeah.
Yeah, it's aggregated though. Representative Damon?
Thank you. I have great respect for the need for data and for confirming that whatever is being done is effective. And I am also really feeling like we already have so much data that tells us how much of a crisis we have. And we really need to be looking at what are we doing to address the crisis more than getting more data. I'm not saying we shouldn't also get data, but I'm hearing an awful lot of conversation about survey this, survey that, we have data this, data that. What are we going to do to address the problem, not just define it further?
Yeah.
I was just saying that would be part of the data. Is not what are the things, but what is done, what is effective, what is not effective. That would be part of what. Well, that's true, but we're doing something. And so is it effective? Is it not effective? Is this school doing something that is effective and this school doing what is not effective? And can we look at that and then say, this might be a more effective solution?
Representative Whitcock?
Karen, I would think there's three parts. There's the mental health intervention, the crisis part we heard about today. The part we started on today is the mental health education, and the curriculum goes to the background and the other things. The third part, Rick, is what you spoke about, is the leadership in the school and what the youngster going back and the discipline, all those things, and that leadership is critical. But I think what we've forgotten in that piece is the parental support for the leadership in the school. And if you don't have parental support for the leadership in the school, then the leadership in the school starts to diminish and shrivel up, and is not effective, even if you are an effective administrator. And I think that's like the other hanging chad out there.
I guess too, that's where the communication between the teacher and the home, but also the administrator has to be supportive of the staff within that building. And if you're not, then it's going to go downhill real fast. I can remember in a building that I had that I came in, I think I mentioned this before, where I collected all the report cards and I found out the average grade in the school was like A-, in a huge school. I said, well, I didn't know all our kids were geniuses. And then I went back to the teachers and they said, well, the parents are looking for, now wait a minute, I said, a C is a C, that's average, they're doing a pretty good job to get that. But what happens when they come in and complain? I said, send them to me. And that's where the principal has to stand up and say, this is the expectation of this school. And that's the difference between schools which are schools of excellence and those schools which are just okay. And I'm a firm believer that leadership and staff have to work together. But leadership has to be there saying, yeah, this is a yes or this is a no. I guess I get my point across there. Representative Tanner?
Did you see the 2+2 video? Rick,
No.
we'll make sure you get a copy of it.
So I agree with Representative Woodcock that we've got at least three distinct areas, but I think one of the ones that we can focus on and try to really make a difference right away is school climate, and the school climate being, the healthy habits of well-being. Number one, good leadership that understands how important that is. Food, every kid's not hungry. And having, some of the, again, going back to some of the legislative decisions we've made that have been put into law that really restrict having a healthy climate in a school, being able to have a healthy climate in a school. But I think that's one part. That's not therapy, okay? And you've got to divide that up. Teachers don't do therapy, okay? They do as much social emotional help and setting these areas for well-being and trying to make the climate the best for the child to learn and the best for the child to grow. And that shouldn't be restricted.
Representative Ford?
I think one of the things that we're stepping around without saying is that a lot of the decisions that affect this are made in the communities in the way they're willing to fund the schools. And I have read school assignments where you have certain number of special ed kids and they're all supposed to have individualized education or help. And they're clustered together in one room under a teacher with the right certification, but they're taught as a group. And the time that they're taught, that they count, includes the time of walking from the other prior class to that class. And so they played with the numbers. And the fact was, the students didn't get what they were supposed to get. And it was a decision made largely, apparently, on budget reasons in the case I saw. And we've got to look at that question of, is special ed something that we should fund from the state or at least assist, rather than say it's a local school decision?
Education in general is well represented.
You got to remember that special education is a different ballgame than what's going on in the classroom. And the social, emotional, behavioral issues in a classroom are not necessarily that of special education. And you have several categories there dealing with mental health. You have other health impaired, which has exploded a little bit. However, the special education, I'd like to congratulate special ed teachers. The way they're being put into these situations and they're having to deal with, and caseloads are increasing. Difficulty of handling some of these situations is beyond what I ever saw in schools. And so I don't think we're sideloading these kids. We're trying to mainstream those, especially with disabilities, into the classroom, and that's where we're coming up with the paras and all. So I think we've gone by that hurdle. I think the issue we have is we got to get back to this bill itself. There's several bills. What is a comprehensive mental health program? How are we going to support mental health in the classroom? How are we going to prepare teachers to do that? And what are going to be the support services for the teacher when you have to get intervention beyond what the teacher's prepared and trained to provide? But I know that the good teachers I've always seen, they treat their classes almost like a family, and they put money in the bank. In other words, they put all that invested time in the bank, and when they have to pull it out with a kid, there's the kid's willing to work with that teacher, and it becomes a situation. It's a pretty positive situation. So a lot of it, I think, comes from, those professional teachers, and where they get that. A lot was on the job training, but there's also, I don't know what's going on the higher education level now, whether we're getting into things besides knowledge and skills, but we're also getting into the area with the pedagogy, the ability to, and the methods necessary to work in today's education environment. I'd like to ask those questions. I think we can fix things properly here. It can be done. It's just going to take, we need to spend a couple of months here whittling and drilling down and unpacking this whole thing. And trying to get a bill that's proper and it's going to support and be put into statute in the right places. And that's about what we can do as a legislature. It's the rest is incumbent upon the school districts and I believe leadership in those buildings. Yeah, Alicia.
I want to go back to what I learned at SEL trainings and conferences and stuff. About the importance of school, parent, and community. And the question is, what can we do to try to form those bonds that have been broken or that don't seem to exist in a lot of places? And there have been communities in this state who worked hard to get parent-teacher bonds, and they had extremely successful SEL programs, and the number of incidences in the school decreased dramatically, behavioral instances, etc. And so we've seen in this state schools that have been effective. The question is, what can we do to encourage that across the state and try to get those programs and whatever? We have schools who are very welcoming to parents and schools that are not at all welcoming to parents. They don't even want parents in the buildings. And how do we fix that? How do we rebuild those bridges like some of the districts have done? Because I think that's what's going to make a difference. It's not a just school, that siloing again, just school, but how do we get out of the silo into the community?
We know what the schools that are doing it a good job, what their best practices are. What's their percentage of the parents attending the parent-teacher conferences, for one? What are there any parent advisory councils within that school? We used to have them where I was, and we listened. There's a lot of different things which I think you can count as best practice. I think a school that's locking parents out, I don't think that's what the teachers really want. So, yes, Representative.
I don't agree that schools are locking parents out.
Yeah.
When you do any kind of survey across the state, people like their public schools, they like their community schools. If they have kids in school, they like the schools, they like the teachers, okay? It's national political propaganda that kind of stirs the pot with a lot of things, and also bringing up one case scenarios. Whenever you have an institution, whether it's a hospital or a school, any institution where you're dealing with the public, you're always going to get some people who are just not satisfied with what's happening, maybe have some issues of their own or some baggage about schools, and they'll say, you know, they're locking me out, when in fact we don't know at the bottom level what the actual details are. I think public schools that I have worked with, that I now represent, that I have represented, bend over backwards to work with parents. And you're going to get one or two parents that just, it doesn't matter. That's not good enough. And so I think we have to stop looking at the one-outs, the outliers, and look at the vast majority of what's happening.
If you want to end, I would just say it is all about leadership. And it's the leadership that sets the tone and makes the demands.
It was just like
you hold them to the standards.
I agree with you, and 100%. Just yesterday, across the hallway, the investigator for Department of Education was testifying on the subpoena powers that the department was looking for, which, you know, I won't comment on that bill, but what month do you think that the investigators notified more by parents than any other month in the school year? We're in it right now. The school year is over. Now the parent's going to complain. And so the school that has the good best practices and openness, I bet you that I go to that investigator and say, okay, what are the schools you're getting this stuff from all the time, or are getting it from? Versus, which ones aren't you getting it from? The ones you're not getting it from are the ones which are open and working with parents. So it comes down to where Representative Cascadon just said. It's leadership in that building, setting the tone, and it's also the school board as well, working cooperatively together. And it's unfortunately, apparently, it must not be happening everywhere. Yep.
Did I hear Chairman Milo, where the chairman said we're.
Yeah, I was just wondering, did you have lunch already?
No, we don't. 12:30 until you started speaking.
Okay, I'm done. Okay. So what we'll do is we'll come back and we'll get this thing going in September. And the list that Mel has right here, we'll do some of that following up and bring that information back. And we'll take this thing further and hopefully come to a positive end for these three bills. Anything else?
Just a final question. We had a handout on House Bill 1236, the Oversight Committee. And I'm just questioning whether anybody knows there's no public hearings on these standards north of Concord. Are they just not communicating with someone?
I think those standards were, the hearings, as I understand it, were requested
By the districts?
by the district.
So there's
If you
none
would have one
requested
up
north
there-
of Concord? Okay, that tells you something.
Are you going to request one? Because I've been waiting to go to one of these and they're all down in the south.
I've been trying to get one in Claremont, and I believe that the school admin there is going to request one if they haven't within the last week or so.
Uh-huh.
But I think DOE sounded like they wouldn't do it until the end of summer. Like they've done all the-
DOE doesn't even do it, it's Vermont.
This is not the department.
Not the, I'm sorry.
This is state, it is Fred Bramante. Yeah.
Same thing. Same
Yeah,
thing.
yeah.
Misspoke.
It's a contracted service, yeah. Okay, we're done. We're adjourned for today. Yeah.